Guys, today we are going to discuss about disorders of middle ear. In that chapter we are going to discuss about acute suppurative otitis media. Okay, so as you see, acute means it less than 6 months. So suppurative means pus. Otitis media, middle ear infection. So it is caused by pyogenic organisms. So middle ear implies middle ear cleft, that is eustachian tube, middle ear, attic, atus, antrum and mastoid 8 cells. So coming to etiology, so you have to follow the same order. Like first, when the patient complains of infection, what we will think? So we will first think what are the causes. So and whom you will see more commonly. So we will see more commonly in infants and children of lower socioeconomic group. Okay. So normally upper respiratory tract if get infected, so you will see this ASOM. Okay, coming to roots. So we will think after that. So how it spreaded? What are the roots of infection? So first one is eustachian tube. So eustachian tube, it maintains a pressure between the middle ear and pharynx. Okay, right? So via the eustachian tube, most commonest route, and in children it is very shorter tube. Okay, so this is spreading, the infection spreads through the lumen of the tube, so or along the subepithelial peritubal lymphatics. Okay, eustachian tube shorter ga untadi infants lo. So while breastfeeding, if she is feeding the baby in supine position, the baby will be obviously in the horizontal position. Then there is a chance of spreading when the baby ingests the milk. The fluids may go into the middle ear through the tube, eustachian tube. So through oropharynx it may go into the, through eustachian tube it may go into middle ear. So this may cause ASOM. Okay, so we have to keep the head of the baby little higher to prevent this. So if you prolongly swimming also, you will get ASOM. So via external ear means some cause of trauma. So some during trauma there may be infection to the middle ear. Okay, which so blood-borne infections also, it is very uncommon. So coming to predisposing factors, what are the predisposing factors we will think? So normally URTA you will think commonly, and tonsillitis, some nasal tumors, nasal allergies, chronic rhinitis, sinusitis. Okay, cleft palate, you will think all of this. Normally upper respiratory tract infections you will remember, and nose, nasal allergy and tumors of nose is all you will remember. So bacteria, which bacteria will cause? Most common organisms which are affecting the our respiratory tract are Streptococcus pneumoniae, Haemophilus influenza. So these only they are causing ASOM. So Monoxella catarrhalis. So other organisms are first forming organisms you have to think. So they are streptococcal pyogens, and most commonly first forming organism is Staph aureus. You all know. Pseudomonas aeruginosa also, which is anaerobic organisms. It also form pus. So you have to think of pyogenic organisms. And Haemophilus influenza, catarrhalis, beta lactam they will produce. So they will cleave the beta lactam ring of the antibiotics like penicillins and cephalosporins. So you can't administer these penicillins and cephalosporins in case of Haemophilus influenza and M. catarrhalis, which are causing ASOM. Okay, coming to pathology and stages of clinical features. First is tubal occlusion stage, second is pre-suppuration stage, third is suppurative stage, and fourth is resolution stage, and fifth is stage of complications. Coming to stage of tubal occlusion, when will the tube get occluded? First one is if there is any edema. If edema is present, the tube get occluded. Hyperemia means increased blood flow to the nasopharyngeal end of the eustachian tube. So this all will block the tube, so which leads to the absorption of air. If air will get absorbed, and then there will be a negative intratympanic pressure will be created inside the tympanic membrane. So then if the negative pressure is there, then there will be some retraction of the tympanic membrane. So some effusion will be also seen in the middle ear. So fluid we cannot appreciate. So what the patient complains of? Patient complains of hearing loss. So ear pain. Okay, these two. So no fever. The complaints of no fever. Signs what we elicit are tympanic membrane will be retracted, with the hand on otoscopic examination, we will see this retracted tympanic membrane with handle of malleus will be in the horizontal position. Prominence of lateral process of malleus, loss of light reflex you will see. Tuning fork test you will do, you will find the conductive deafness. Okay, coming to stage of exudation and presuppuration. As there is tubal occlusion, if it is prolonged, then the pyogenic organisms, what they will do, they will invade the tympanic cavity. So, and they will cause hyperemia of its lining. Inflammatory exudate appears in the middle layer. As the organisms, they invade the cavity, so there will be increased blood supply to that lining, and exudate will be formed in the middle layer due to inflammation. So tympanic membrane will get congested. Congested means some swelling will be there in the tympanic membrane. What symptoms the patient complains of in this stage? He complains of commonly earache. So he will say the pain is so heavy, that the pain is so much severe, so that he can't sleep, and the pain is of throbbing nature of pain. So hearing loss will be seen, and tinnitus, some buzzing sensation of the in the ear will be presented. So complain only by adults. Usually child runs high degree of fever and he is restless. So what are the signs we will elicit? Signs will be there will be congestion of pars tensa. So congestion will be seen swelling, and blood vessels will be appearing on the handle of the malleus. Okay, so and at the periphery of tympanic membrane, we will see cartwheel appearance of the tympanic membrane because of these. So all of the tympanic membrane, including pars flaccida. So we have three parts. So one is pars tensa, pars flaccida, another one is pars another thing. Okay, this pars flaccida becomes uniformly red. Tuning fork test will again show some conductive type of hearing loss. Okay, as we saw in stage of occlusion also, we will see conductive type of hearing loss. Okay, coming to stage of suppuration. Suppuration is formation of pus in the middle ear. So tympanic membrane starts bulging to the point of rupture. So earache become excruciating. We will see child may complain of fever in this stage, and vomiting you will see, and convulsions you will see. So signs will be tympanic membrane will appear red and bulging. So no landmarks will be lost. Handle of malleus may be engulfed by the swollen and protruding tympanic membrane. So yellow spot will be seen on the tympanic membrane. Okay. So it will be seen as nipple-like protrusion of the tympanic membrane, and this tenderness also elicited over the mastoid antrum. So we will offer X-ray mastoid or CT scan. Temporal lobe will show clouding of hair cells because of the exudate. So myringotomy should be indicated in this stage. So in this stage of resolution, the tympanic membrane will get rupture and the pus will be released. So symptoms will get resolved. So proper treatment should be started earlier if patient complains of these symptoms. So then we can prevent the rupture of the tympanic membrane. Symptoms will include evacuation of pus. Pus will be symptoms with evacuation of pus. Earache will be relieved, and fever will be come down, and child feels better in that time. Signs: external artery canal will may contain blood tinged discharge, so which may become mucopurulent. Small perforation in the anterior inferior quadrant of pars tensa. Hyperemia of the tympanic membrane begins to subside. Okay, stage of complications: virulence of organism high, or resistance of the patient is poor. Resolution will not take place. It may lead to some complications like acute mastoiditis, subperiosteal abscess, facial palsy, labyrinthitis, periostitis, and extradural abscess, meningitis, brain abscess, or lateral sinus thrombophlebitis. So what are the treatments? Antibacterial treatment for the, so like ampicillin 50 mg per kg per day, amoxicillin 40 mg per kg per day. So those who are allergic to penicillins, we should use cefaclor, clotrimazole, or erythromycin. And beta-lactam producing organisms, we should give amoxicillin, clavulanate, cefuroxime, and cefixamine should be used. Okay, antibacterial should be continued up to 10 days. Okay. So decongestant nasal drops, ephedrine, no, nasal decongestants, ephedrine and 1% in adults, 0.5% in children, or oxymetazoline, nacevion, xylometazoline, or Trivin should be used to relieve the eustachian tube edema and promote the ventilation. Oral nasal decongestants like pseudoephedrine 30 mg BD should be given. A combination of decongestant and antihistaminic may relieve the same, may achieve the same result. Okay. Analgesic antipyretics should be used. Commonly paracetamol should be used. Ear toilet will use. So cotton buds, antibiotic solution should be inserted. Try local heat will help to relieve the pain. Myringotomy should be performed. Okay. So we should incise the drum to evacuate the pus. Okay, the drum is bulging if there is a acute pain. Incomplete resolution despite antibiotics when drum remains full with persistent conducting hearing loss, and there is a effusion beyond 12 weeks. So all cases of acute suppurative otitis media should be carefully followed. So until the tympanic membrane appears normal. So drum will be bulging, acute pain will be there, incomplete resolution will be there despite the antibiotics, and conductive hearing loss will be there, and persistent effusion will be there beyond the 12 weeks. So these are the indications for myringotomy. To evacuate the pus, we will incise the eardrum. So acute otitis media, first antibacterial therapy we should use. 48 to 72 hours review should be done. Earache and fever persist or increase, good response will be seen. These two are the responses. So if persists, so we will continue antibacterial therapy for 10 days and or myringotomy and culture and specific antimicrobial for 10 days. So after this, complete resolution will be seen. Persistent fluid but earache and fever abate, complete resolution will be seen. Good response, continue the same for 10 days. So we will see this following. Okay. Then if persistent fluid but earache and fever subsides, then we will periodic check will be done for 12 weeks. Then there will be complete resolution or persistent effusion. If there is persistent effusion, treat as otitis media with effusion. We will discuss it in another topic, another video. Okay, thank you guys. Thank you for listening patiently. Thank you.